Hello everyone and welcome to Inside Healthcare. We're coming to you from inside the urgency room in Venice Heights. And we're pleased to have with us Dr. Rob Anderson. Thank you for being with us.
My pleasure. Thank you,
Jody. And
he's
he's the Assistant Medical Director here at the urgency room. So what is the urgency room and what is it all about? How does it differ from, say, urgent care or an ER?
Well, certainly, Jody, we're not an emergency department because patients come to us not by way of ambulance, but typically they drive here, and we're also not attached to a hospital. But we're able to take care of some of the same conditions that you can in an emergency department. For example, patients come into us with abdominal pain and we can do ultrasounds, CAT scans, determine if they have appendicitis or if their gallbladder is infected. If people come in with chest pain, we can determine if they're having a heart attack. Now, we have some of the medicines that we can give for heart attack, for infections such as pneumonia, or common things like strep throat. If you need to be admitted to the hospital, we can also arrange for direct admission to whatever hospital the patient wants to go to. Thereby, they don't have to wait in an emergency department for hours upon hours at end.
And this is one of several locations that you have around the Twin Cities.
We do. We have 3 different locations in Woodbury, Venice Heights here, and then also in Eagan.
What would be the advantage of coming to an urgency room then?
Well, here at the urgency room, we're able to take care of just about everything that you could in the emergency department if you don't feel that you have to call 911. The advantage of coming here is, on average, our bills are typically 30% less expensive compared to the same concern going to an emergency department.
And now we're talking with Dr. Timothy Johnson with the urgency room here at Venice Heights, one of the physicians here. So this is just a typical patient room here. So you see a lot of people coming in with severe headaches, migraines. What's the difference? What causes them? How do you treat them?
Boy, you know, headaches are something that we treat here at the urgency room, and I think there's something that people often don't get very satisfactory treatment for when they go to the clinic or when they go to the emergency room for that matter, because when they go to the clinic, a lot of times they need IV medicines. They need to have an IV placed, they need IV fluids, they also need medicines given to them that a lot of clinics really can't do.
So what is causing the migraines and how does some of the IV treatments, how does that help alleviate the things that they're experiencing, not just headache, they have other symptoms as well.
Yeah, so specifically about migraine headaches, what causes migraine headaches is a little bit of a mystery. But what we know is it's an interplay between the neurons, the cells within the brain, and the vessels, the vasculature, the vessels that bring oxygen and blood flow to the brain. And those can spasm, open and close. There can be some abnormal signaling that goes on with the nerve cells or the neurons. And in the end of the day, that ends up being a full-blown migraine. People typically feel those coming on, and if they have medicines that they can kind of cut it off at the pass, they like to do that, but every once in a while they can't, and then all of a sudden, oh no, they're into a full-blown migraine. And it's typically a headache that they feel on one side of their head. It's throbbing, it's exceedingly painful, the light hurts their eyes, they're nauseated, oftentimes they're vomiting, and they're miserable.
You know, I hear from lots of people that have migraines that they have a sensitivity to light, they have other symptoms. What would be some of those common symptoms that you see?
So the thing that you're talking about is often called an aura. And a migraine aura is a sense of scintillations, flashing lights, typically in the periphery of the vision. What's really funny about that is some people can have a migraine with aura and not even have much of a headache. And conversely, some people can have just a little bit of aura or not much at all, and yet they get their full-blown migraine headache. And so that's just a feature that kind of lets us know that that headache that they're having truly is a migraine.
And what would be the advantage of coming to the urgency room versus going to an emergency room?
Well, the first thing that's an advantage is the wait. Right now, sadly, across the country, we have now crossed nationally the 4-hour mark. The average wait in an emergency department is 4 hours and 2 minutes. The wait in the urgency room is a fraction of that. Typically, if it gets as much as even 15 or 20 minutes, we are scrambling to get people in and seen immediately.
And if they're suffering from a migraine, they want help as soon as possible.
Exactly. And then the other thing that's really kind of nice about the facilities here in the urgency room is we have the ability to start an IV and give IV fluids, because while these people with migraines are not typically dehydrated necessarily, they need to be hyperhydrated. They need to be have an excess of fluid. Their brain needs to be very much hydrated, and that is a big deal in making their migraine go away. That, in addition to that, typical IV medicines that we use are specific for migraine headaches and work like magic to help it go away.
And these are something that can happen at any age, any time, migraines?
Migraines typically run in families, and for reasons that we don't understand, tend to affect females a little bit more than males. And what we know is that there's triggers for migraines that can make them worse. We know that, for example, some types of alcohol, typically red wine, for example, tyramine-containing foods, some kinds of cheeses and salamis, things like that can make migraine headaches come on as a trigger. Stress, to a certain extent, can make migraine headaches come on as a trigger. And so there's a lot of things that can kind of cause them. But the sad truth is that a lot of people with migraine headaches suffer from migraines for their entire life. And so when they feel it coming on, they're kind of thinking, oh no, here it goes again. And all they want is relief, and they want it now.
You know, at this time of the year, too, we're starting to turn our heat on. Some people use a space heater, fireplaces, things like that, which also increases the risk of CO poisoning, and which is something that you see in the urgency room as well.
I am so glad you brought that up, because this time of year, when the heating season starts up, this is when we're really starting to kind of add that little piece into the list of things that we're thinking about in terms of diagnosis. And anytime anybody has any sort of flame anywhere in the house, that can be a furnace, that can be an oil furnace, a gas furnace, it can be anything that's got an open flame in the house. That can be a source of carbon monoxide poisoning. And anytime, you know, I guess my point would be headaches should never be contagious. So when everybody in the house all of a sudden has a headache at the same time, and everybody has this kind of icky flu-like feeling all at the same time, ding, 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 we're really worried about carbon monoxide poisoning.
Before we started taping, I actually mentioned that happened to my mom and my sister too. One was feeling symptoms, and then she discovered my mom also had it, and they found out it was something with the furnace. First time turning it on that year.
And the most important thing when that happens is get out. Second most important thing is we need to get you on some high flow oxygen, supplemental oxygen, which is a capability that we have here in the urgency room. And the third thing you need to know is what your level is to see how dangerous it is. And that's something that we have the capability to test here in the urgency room that is typically not able to be done in a clinic.
And how do you test for it?
We have a probe that we can actually put on your finger that's a co-oximeter probe that can actually measure that directly.
And it's important to get treatment fast.
Absolutely.
Yeah, and we see way too many cases like that here in the upper Midwest and in Minnesota as well.
Yeah, really sad, tragic things that can happen.
Yeah. So you also treat children, pediatrics here, as well as adults, and you treat them sometimes for head injuries and things. How does it differ between a child and an adult, treatment? I'm
so glad that you asked that, because the way that we think about working up a child with head injury and an adult is very, very, very different. So with children, the minute parents hear that kind of sickening crack sound when that hits the ground, their heart goes up in their throat, and they are in panic mom and dad mode. And they show up and they want to know, is my kid going to be okay? And one of the important things to kind of think about with that, and one of the very first things they kind of say is, oh my gosh, I need to have a CAT scan. And so we certainly have that capability here in the urgency room, and certainly we do that from time to time, but one of the things that we try to get parents to think about is, we're glad that you brought them here, because it's very important that children that have had a head injury get seen by someone who is used to seeing children with head injuries. There's certain touchstones of the physical examination, looking at the back of the retina to look for swelling of what we call the back of the eye or the fundus, looking to see if there's any blood or fluid collecting behind the eardrums. That could be a sign of basilar skull fracture. Being able to feel the skull to make sure that you don't feel a step off or anything that could be a depressed skull fracture. And one of the questions you may have is then, why don't we just for safety scan everybody? And the reason is because in children who have developing brains, and they have developing brains, any rapidly dividing cell like that, if it gets exposed to ionizing or X-ray radiation, has the possibility of having mutation, which we now know is the basis of tumor and possibly cancer. We also know that with a 1-year-old child that receives a single head CT, that their odds of having a tumor in their brain at some time decades later is about 1 in 1,000. That drops to 1 in 5,000 by the time that child is 10 years old. And by the time that person is an old person, and in radiographic years, old means over 30, it really the risk then drops off exponentially. And so as a result of that, an individual who let's say we have grandma or grandpa who are 60 or 70 years old, and they're on a blood thinning medication, like warfarin, or they're on aspirin, and they've hit their head. What we know is that their brains tend to atrophy and shrink over time, and that the veins and vessels that are bridging parts of the brain actually can be under some tension. And there's a little bit of room inside of there. So when they hit their head, they can actually have some bleeding that goes on possibly for some period of time before they really show symptoms. A child, conversely, they're packed in that skull pretty tightly. And so, and what we know is that head bleeds are actually very rare for children, and they're very common for older adults, especially those that are on
and
those
just
medicines.
briefly, how does the CT scan help you in diagnosis and treatment of the young and the adults?
The important first thing to know about the CT scanner is the limitations of what it can and cannot tell you. What it can tell us is if there's a skull fracture, if there's blood within the brain, or if there's edema or swelling within the brain. What it cannot tell us is if there's concussion, because concussion is actually a clinical diagnosis. Concussion is actually, there's no anatomic feature. By its definition, there's no anatomic feature that tells us it's there. It's a physiologic thing. In other words, it's a constellation of symptoms: fatigue, headache, a little bit of lethargy, lassitude, inability to concentrate, irritability with loud noises. And what we know is that people that have had head injuries, a certain number of them will go on to have concussions, and an even smaller number will go on to have post-concussive syndrome, where they have those symptoms for an extended period of time, longer than is expected. What we don't know is who's going to be who, because it turns out that the incidence of post-concussive syndrome, as well as concussion, is not necessarily related to the severity of the head injury.
Interesting. So it's just time will tell.
Exactly
perhaps,
right.
And they need to be seen as soon as they have something like that to rule out other things, other
They
problems.
need a skilled set of medical eyes to take a look at them. And then they need to have a clear-eyed view of the risks and benefits of getting the CAT scan versus not getting the CAT scan, and making sure that family members are involved in shared decision-making to make that decision. And then if the decision is made to just watch that patient, we educate the parents and the family members as to what to look for, and so that they don't have to worry, and they'll know what to do if they see certain symptoms coming up, like vomiting that comes late, confusion that comes late, or lassitude that comes late, that they then bring that person immediately back to us or to an emergency department.
And as we heard with Dr. Anderson, you can handle a lot of different cases here, a variety of cases, whether it's a head injury or it's CO poisoning and things like that.
And we're really proud of that, because we kind of, as emergency physicians, one of the things that we kind of struggled with was people, our friends and families, that didn't want to go to the emergency department, and they'd say, oh my gosh, I had this head injury happen and I felt like I needed to go to the emergency department, but I didn't want to wait so long, and so what urgent care would you have me go to? And my answer was none of them, because it hadn't been built yet. So we are very proud of this facility because it has the CT scanner. It has the ability to give IV medicines. It has the ability to diagnose some of these serious conditions and stabilize them. And it's all in one place.
All right. Well, Dr. Tim Johnson, it's been a pleasure to have you with us, and thank you for great information for our patients.
Thanks for coming.
And our viewers. Thank you. And we're back with Dr. Rob Anderson in the urgency room in Venice Heights, the assistant medical director here. Thank you.
Thank you.
We're in a room with some equipment, and you have a lot of high quality, high tech equipment here at the urgency room, from ultrasounds, the newest ultrasounds, to x-rays, to this mini C-arm.
Yep.
And we're going to talk about this in just a second, but I think people are familiar with ultrasounds for pregnancies. How else do you use those here in the urgency room?
Well, Jody, that's a great point. Most people do commonly associate the ultrasound with pregnancy and seeing the baby grow and move. And we have an ultrasound here, and we're able to look at the baby in very early stages of life to make sure that the baby is in the uterus and that there's no bleeding around the baby. But we also use ultrasound on a daily basis to detect if somebody has a blood clot in their leg, to look at their gallbladder to see if it's infected. In our pediatric population, we really try to minimize the amount of radiation that they undergo. So we use an ultrasound to determine if they have appendicitis or not.
So there's no radiation with the ultrasound, but there is with X-rays. And
that's correct.
And the newer X-rays give off less radiation.
Yeah,
what are the risks?
That's the goal, is to expose a patient to the least amount of radiation as possible, which is why we have the ultrasound, but we also have x-rays if needed. Commonly, x-rays will be ordered if somebody thinks that, they fell on their arm and they think they might have a broken arm or a broken leg. We also use x-ray to look at the lungs. So that's how we determine if somebody has pneumonia or a collapsed lung. We use x-rays for that. Sometimes even for foreign bodies, if somebody thinks that they have a piece of metal in their arm or something like that, we're able to use the x-ray to determine if they have that.
And this is something you might not necessarily see at some of the retail care places that we see.
Yeah, Jody, I had a patient the other day who went to a local walk-in retail clinic, and they had fallen on their hand and they hurt their hand really badly here. So they went there and they said, well, it might be broken, you should go to an urgent care. Then they went to that urgent care and they said, I think it's broken, and they actually were able to do an x-ray there. And they found out that it's broken, but the bone was out of alignment significantly. So they had to come here to the urgency room, and we were actually able to use a local numbing medicine to numb up that broken bone so it didn't hurt, and we put that bone back in place.
All right here at one spot here.
Yeah.
And then what is this C-arm? What is this all about, and how to use this?
Well, the C-arm is essentially a portable mini x-ray machine. So for a patient who falls out on their arm and breaks their distal bone in their wrist here, we use this commonly to help put that bone back in place, and while we're actually putting it back in place, we use this to determine if it's in good alignment or not.
And that differs from the x-rays and things.
Correct. So the x-ray is just, you go, you get an x-ray. This actually has live streaming of the x-ray while we're putting the bone back in place to make sure that we're getting it back in proper alignment, right exactly where we want it to be.
And I don't think people think of this type of high-tech equipment being on location at an urgency room and not at a hospital or other facility.
Correct. So the C-arm, you're going to find this in an orthopedic office. You'll find it in a local emergency department. But this is not a piece of equipment that you're going to find typically in an urgent care. But here at the urgency room, we do have this. So you don't have to go to a walk-in retail clinic to an urgent care. If you come directly here, we can get the basic x-ray to determine that if you have a fracture or not. And if it's broken and out of alignment, we can use this to help put that bone back in place.
And it sounds like it makes it more efficient, more faster
Absolutely.
and everything like that. What other advantages do you have to having this on-site equipment?
Well, and patients don't have to go to the emergency department if we're able to take care of it here.
That's sweet and quick.
Yeah.
So if someone wants some more information about the urgency room, where can they find that information?
Well, if you go to urgencyroom.com, you can go on there and you can get information about all three of our locations in Vadnais Heights, Woodbury, and Eagan. And actually, if you go online, you can see what our wait time is too. On average, you can see it's much quicker than waiting in an emergency department.
Well, it's been a pleasure to talk with you, and thank you for taking time out to be with us.
My pleasure. Thank you.
Thank you. Please be safe, everyone, this holiday season. Thank you for joining us. We hope you join us next time on Inside Healthcare. See you then.